Medicaid enrollment has reached historic highs, and the numbers tell an important story about where the program stands today and where it needs to go. According to the latest data, nearly 75 million people were enrolled in Medicaid and CHIP as of February 2026. That's about 3.5 million more than before the pandemic began. Even after the emergency measures have ended and states have started reviewing their roles, enrollment remains roughly 5% higher than pre-pandemic levels. Why does this matter? Medicaid was designed to serve low-income families, children, seniors, pregnant women, and people with disabilities. But when eligibility checks are paused, as they were during the pandemic, the system can end up covering people who no longer qualify. That's why accurate eligibility reviews and strong oversight are essential for a program of this size. This is where the One Big Beautiful Bill Act comes in. H.R. 1 proposes reforms to restore integrity to Medicaid and CHIP. The bill would strengthen address verification, create a federal system to prevent people from being enrolled in more than one state, and require more frequent eligibility checks for certain adults covered under Obamacare expansion. It would also tighten verification rules for citizenship and immigration status before federal funds are spent. Another key feature is the introduction of community engagement requirements, or work requirements, for able-bodied childless adults. These requirements would not apply to those who are medically frail, caretakers, or part of other protected groups. The goal is to focus Medicaid's resources on the truly vulnerable, while encouraging those who can participate in work, training, or volunteering to do so. Finally, these reforms are about protecting both patients and taxpayers. Every dollar lost to improper enrollment or fraud is a dollar taken from those who genuinely need care. By enforcing eligibility rules and rooting out waste, Congress can ensure Medicaid remains strong for the people it was meant to serve.